Have you ever encountered an unexpected event, a repeat of something that occurred to you that appeared in your daily newspaper and caused you to leap out of your chair and rush to the victim's aid? A young woman in her 20s, residing in the state of Minnesota, was shocked when she found out that the frightening incident she had gone through a few years earlier had occurred in the life of another. Let's see what happened to her then, and how she related her agony to the ordeal of a 16-year-old girl who did her daily chores while on life support. The 16-year-old girl who walks and eats tacos while on life support. The 21-year-old woman was stunned as she read the title as she scanned the article about a girl whose lungs were overpowered by a mystery sickness and now required a breathing machine to stay alive. She told herself, upon completing the article, "I need to do something." She believed she knew exactly what was killing this young child because 6 years prior, the same scenario could have been her own. Back then, she was a junior in high school and a starter on the girls' volleyball team. Within days of the start of the new school year, she suffered from a fever and sore throat. Her doctor in the tiny Minnesota town of Thief River Falls suspected she had a viral infection and predicted she would recover after a few days of rest. However, he was wrong. The girl's fever subsided, but was replaced with the most profound exhaustion she had ever experienced. Just getting out of bed left her gasping for air. Her mother drove her 25 kilometers to the nearest emergency room. Her troubles started before she knew anything about what she was about to go through. The nurse became disturbed when she examined the young woman's vital organs. The patient's oxygen saturation, which would ordinarily exceed 90%, was in the 60s, a dangerously low level. An X-ray of her chest revealed a dark cloud entering her lungs. Minutes later, medics took her to the nearest hospital with a pediatric intensive care unit. The treatment started, but not to her rescue. She received multiple broad-spectrum antibiotics. The doctors did not know which pathogen was causing her pneumonia, but they believed these drugs would protect her. However, her condition worsened gradually, and within days, she was placed on a ventilator. The patient's lungs were barely functioning. The following step was an artificial heart and lung machine known as ECMO. This device, roughly the size of a refrigerator, acts as a lung to remove carbon dioxide from the blood and replace it with oxygen, and as a heart to circulate the oxygenated blood back into the body. The ECMO team hooked the young woman up to the apparatus, and the machine breathed for her for 116 days. The agonizing months awaiting a transplant. She, like the girl in the article, had walked while attached to the enormous machine and consumed food while remaining connected to the device. The medical team was never able to determine why her lungs failed. She waited on the transplant list for months, awaiting a new heart and lungs to replace the ones her doctors believed she would never recover from. However, they were once again proved wrong, and she, after 7 months in the hospital, was finally discharged from the hospital. Every 6 months, the woman went for a checkup for several years. During these visits, she always visited the pediatric intensive care unit to see the nurses who had been like a second family to her during her stay. During one of her visits, 2 years after her own hospitalization, multiple nurses told her of a child whose disease was strikingly similar to her own. A few hours later, she and her parents met with the child's parents, who related the story of their 12-year-old daughter, whose lungs had ceased functioning following what appeared to be a viral illness. The families compared what they knew about the two kids to see if their lives and experiences were similar. The child's parents indicated that their daughter had been taking the antibiotic trimethoprim-sulfamethoxazole, TMP-SMX, marketed under the brand name Bactrim in the weeks leading up to her hospitalization. The woman exhaled sharply. She had been taking this antibiotic, in her case to treat acne, up until the day she visited the emergency room. The story repeats itself. Since then, another family has approached her with a similar story. A previously healthy and active adolescent falls gravely ill and requires life support due to severe lung damage. The parents mentioned their son took trimethoprim-sulfamethoxazole for his illness. With a total of 3 instances, there had to be a connection between the medication and the hospitalizations. And now, this young woman appeared in the news. Her name was Owadia. Owadia was being cared for by Dr. Jenna Miller, a pediatric ICU expert at Children's Mercy Hospital in Kansas City, Missouri. The young woman found the doctor's email address and promptly sent a message. She added, "I began using Bactrim for acne about 3 to 4 weeks before my acute lung failure. This occurred to at least 3 youngsters aged 12 to 20. Uncanny similarities exist between our cases." She inquired whether Owadia had also been taking trimethoprim-sulfamethoxazole. Identical, yet unusual pattern. Miller was dumbfounded. The girl was taking trimethoprim-sulfamethoxazole when she became ill. Could a connection exist? Miller reached out to a pediatrician trained in infectious illness and clinical pharmacology who had been conducting studies on this drug's side effects for years. Trimethoprim-sulfamethoxazole is an effective, safe, and economical medication and is the 6th most commonly prescribed antibiotic in the United States. Nonetheless, the physicians agreed that an investigation was necessary. 2 pediatricians gathered the medical records of the patient who wrote the email and any other cases she had discovered. Each young adult acquired a severe lung infection after a brief illness, and they all took trimethoprim-sulfamethoxazole. The biopsies of the affected lungs were what convinced the doctors that there was a link. Each displayed the same unusual pattern of focused destruction. The only cells within the lung affected were those that took up carbon dioxide and supplied oxygen. These vital cells eventually grew back in 2 patients, including the patient who first noticed the link between her illness and the drug, allowing them to breathe on their own again. Others who did not recover their lung tissue required a lung transplant. The first 2 cases were fatal: the 12-year-old who the young woman met, and Owadia, the girl featured in the news story. The outcome. In total, Miller and Goldman have identified a total of 19 patients in the 4 years since Miller received the patient's email, the majority of whom were under the age of 20 and had the same reaction after taking trimethoprim-sulfamethoxazole. It is still unknown how the antibiotic causes this uncommon but devastating destruction. Goldman believes it is most likely an allergic reaction. However, they can still not predict who is at risk or why. Dr. Miller uses this drug frequently as an ICU doctor, and while these incidents are rare, the destruction it causes is devastating. Most of these people were not being treated for life-threatening illnesses, she says of the 19 cases, and yet they were given this ordinary drug and it changed their life forever. We can hardly understand what's wrong in our body until and unless we face direct symptoms and indications. Often it's too late and life-threatening. We need to take care of our vital organs if we want to keep our health in check and keep our bodies in good shape. What do you think of this case? Let us know in the comments below.